Welcome. Thank you for joining us today for the National Hispanic Medical Association's 2023 Texas Virtual Asthma Advocacy Meeting as part of our Amgen Asthma and Hispanics Education Campaign. And my name is Dr. Elena Rios. I'm President and CEO of the National Hispanic Medical Association here in Washington, D.C. The NHMA is a nonprofit association representing the interests of nearly 50,000 licensed Hispanic doctors in the country. And our mission has always been to empower our physicians, members, especially Latino physicians, and others who take care of our communities to improve the health of our communities and other underserved populations in collaboration with all our partners. And we are very honored as partners to have political leaders, policymakers, not only in the federal level, but in the states. And today we're going to be joined by Representative Terry Mesa from Texas.
Yes.
And also Legislative Director Samantha Crane from Representative Elizabeth Campos's office. I think we may also have, we have the Director of Health Promotion and Chronic Disease Prevention from the Texas Department of State Health Services, Nimisha Bhakta. So we look forward to educating you a little about the importance of asthma and the importance of health equity in our communities and how important it is that you continue to support what you're already doing with asthma. And also we like to also learn more about how we can help you with educating our communities and also how to increase the numbers of Latino students that go into all the healthcare careers. So before starting, I just wanted to go over a few housekeeping that everybody's microphones will be muted, but please feel free to use the raise hand feature if we need to ask a question. The recording will be housed on the NHMAMD.org, our website, and our YouTube channel, and the recording and slides will be sent out 1 week after the event. I just want to acknowledge also that we want to thank Senator Boris Miles, legislative aide Sebastian Berry will also be listening in. So let me introduce our two physicians, and then I'm going to just give a quick background. The two NHMA doctors with us today, Dr. Bert Johansson is an executive committee member of the board of National Hispanic Medical Association. He's a pediatric critical care specialist at Centro de Salud Familiar La Fe in El Paso, Texas. And then joining Dr. Johansson is Dr. Tanya Martinez. She is an associate professor and program director, Pediatric Pulmonary Fellowship at the University of Texas Southwestern and Children's Medical Center in Dallas, Texas. Lastly, we will hear from Nimisha Bhakta, who I already mentioned, from the Texas Department of Health to speak about asthma prevalence and the needs in the Hispanic communities in Texas and what they're doing to help our communities from the departments, from the executive branch side. So the purpose of this meeting is to discuss not only barriers and challenges, but more importantly, what are ways we can access healthcare and the newer treatments for asthma. Now we know how many people have asthma in our communities because of all the environmental problems. I'll say Houston, for example, has a lot of problems because of the carbon plants and the shipping and other, all of our inner city areas in Texas have problems with trucks, being next to freeways with all the big emissions and air pollution. And then just different issues that I have to say, that more and more asthma happens in adults too. It's not just a kid's disease, but we do have pediatricians who take care of a lot of asthma to talk to us about it. But we have people now that have severe asthma. And there's new treatments now for severe asthma. We really think that it's important to not only promote the importance of treatment, but promote how do we prevent asthma in the first place And what kinds of policies have you already focused on that we could help with expanding ideas to build on what you already have and to promote the education of future health professionals to know how bad asthma is and how we need more Latino or, Hispanic students in the Texas schools at all levels, high school, college, to think about becoming a doctor or nurse. And we do mentoring, and we have meetings in the Texas area to help find students. And we'd like to work with you on all that. In terms of some risk factors for Hispanics with asthma, in 2018, 2.3 million Hispanics reported that they currently have asthma, and were twice as likely to visit the emergency departments for asthma compared to non-Hispanic whites. The 2022 State of the Air report released by the American Lung Association finds that the Dallas-Fort Worth metro area's rankings were worse for some of the most harmful and widespread types of air pollution, particle pollution, and ozone. The area is now the 16th most polluted city for ozone in the whole United States. Hispanics make up 27% of the total population of the Dallas-Fort Worth metro area. So it's our communities that need better policies, I'll just say, from our great policymakers in Texas. Hispanic children are 40% more likely to die from asthma as compared to non-Hispanic whites. And given that Hispanic face barriers to access quality healthcare, we're still the population, despite having an Affordable Care Act and having health reform to make health insurance more affordable, to educate. There's more education in our communities about the importance of having insurance. Our employers are still small businesses that can't afford insurance, or we have people that just don't know how to read applications or even fill out applications. And then there's a lot of people in our communities, especially those that have undocumented in their families, that don't, have a fear and don't have trust in our institutional programs. So there's 20% of Hispanics in this country don't even have health insurance. So a lot of our communities have that as a big problem and barrier. Hispanic children are, like I said, are 40% more likely to die from asthma, and it's because they don't have access to care. Given that Hispanic face barriers to access quality care, it's difficult to treat diseases such as asthma and severe asthma. And just so that everybody knows the importance of this new vernacular, severe asthma is defined as asthma that does not respond well to standard asthma treatments. It's asthma that is more intense than regular asthmatic symptoms and can last longer for very prolonged periods. And sufferers of severe asthma often find their symptoms persistent and difficult to control. So with that being said, we are here to introduce our two doctors, Dr. Bert Johansson and Dr. Tanya Martinez, who will provide some insight on the challenges of treating asthma and severe asthma patients and their insights, especially in Texas, from the El Paso region and from the Dallas region, on how they need help with policies that could influence their care delivery for the Latino community. And then we will hear the welcome from Representative Terry Mesa and Samantha Crane, and to speak on state initiatives and that their offices are currently working on as it relates to asthma and access to care. And if you want to mention the importance of what you're doing to help us with getting more Latino doctors, we need definitely to help us find the students that are going to be our champions for decreasing asthma. So Bert, Dr. Johansson, you're muted.
Thank you for inviting me today. As you well know, that this is something I'm very passionate about. And for a little background, I am a New Yorker of Honduran descent, Spent also part of my life in Puerto Rico, and then have moved down here to far west Texas and El Paso. And I say that because let's talk about the 500-pound gorilla in the room. There are studies from Salud et al. At the University of Pittsburgh that show that Latinos, Latinx, have a lower rate of diagnosis of asthma overall. And when I was in New York, I found that it was more important that I not know whether they were Latino, but what was their area code, their zip code, especially in areas of the Bronx and Manhattan that are exposed to prevailing winds from New Jersey. Obviously, again, industrial pollution. Then I moved down here to El Paso, and I'm finding that not only am I seeing a high rate of asthma in the population I'm working with, primarily Mexicano, but I'm also seeing migrants and migrant workers who are, as they travel north, Milagro del Norte, they're being diagnosed with asthma, which implies that this is pollution, particle pollution, ozone. I live on the side of the mountain, and when I drive to work in the valley, I see the haze hanging over the valley. The poorest neighborhoods in El Paso are places like Chaguahuita and Segundo Barrio, who have that haze. And that's where the highest rates of not just asthma, but severe asthma are found. Additionally, there's very little access to doctors in this area of town. And quite frankly, if I may be blunt, we don't have an academic medical center which can help push forward with the education of patients and the doctors, especially now that we have these biological agents that are available. Part of the problems was we also have an international border. Our patients can cross to Juarez and get care there. And they may or may not get the care that we would address here in the United States. I'm not implying that my Mexican colleagues are bad doctors, but it's different. And for those of you who care for patients, you understand knowing the meds they're on and their reaction to it to make decisions. Additionally, as I learned when I moved here, the Spanish my mother taught me growing up is different than the Spanish here. And sometimes a single word or way you phrase a sentence can change the meaning. So I want to implore that education, which needs to be part of this effort, make sure that we have people who speak what we call Puche Spanish on the border, and so that this understood. The second issue is, yes, within the Latino community, we have some colorism. We need to make sure that the people who are pushing out this effort look like the people we want to address. Yes, my patients are delighted when I speak Spanish, but I'm a güerito, and there is some distrust. So we need to actually push that more. Secondly, we need to support other institutions in Texas to come help support us here in El Paso with our academic medicine, treatment, bringing in well-educated pediatric pulmonologists, adult pulmonologists, people who keep up with the current literature and able to supply these meds and the treatment to our patients. Additionally, we need, Dr. Rios pointed out, and I think very well, we often hear, oh, I had asthma as a child, but it went away. Did it really? We know that there's remodeling of the lungs when somebody has untreated asthma. As people get older and lose, as we all know, lose our FRC and our ability to take deep breaths, then the asthma, it becomes manifest. And I'm finding, again, in my older patients, that that's often diagnosed as COPD. So these are the issues that we need to address. And finally, I think we need to do the Medicaid expansion. I have too many patients that are not insured, even though they're legal. And we need to have mechanisms so that they'll be able to be seen by the subspecialists they need. Thank you for listening to me. I really appreciate it.
Okay, next we have Dr. Martinez from Dallas.
Hi, Dr. Rios, and thank you for inviting me, because I think this, as Dr. Johansson pointed out, this is one of my passions too. Besides being program director of our fellowship program, I oversee our severe asthma program. So I get to see a lot of these patients on a day-to-day basis. And to add to what Dr. Rios pointed out as far as statistics, we know, or it commonly thought that Mexican and Mexican Americans have a lower burden of asthma overall compared to other populations, including other Latino populations, specifically the Puerto Rican population, which has the highest burden of asthma, and which I understand being a Puerto Rican myself and coming from the island. But really, we've also seen that children with asthma are pretty much in the last 10 years have increased their prevalence of asthma to that similar of the rest of the population in the country. So that may not be something that we see. Those differences may start narrowing. That gap may be narrowing as we see more children grow up, and we've seen that nationally as well as in the state. We have data from the state that also supports that. And our hospitalization rate in Texas is really high for asthma in kind of the two ends of the age spectrum. So in the older patients as well as in the very young patients, meaning that those that are less than 5 have the highest burden of hospitalization rates in asthma in the state. And to put that into perspective, it's been reported that about 100 million Medicaid dollars go into acute asthma care, and 80% of that is in pediatrics. So trying to treat pediatric patients early is important, and not only because it helps our children, but also because it helps our healthcare dollars as adults. It's become much more evident, as Dr. Johansson pointed or insinuated, that adult patients with lung disease have lung disease because we haven't intervened early enough. And that may be because of secondhand smoking exposure, because of nutrition, mostly a lot of social determinants of health. Air pollution is a big one, having children live in poverty and having them, because of all the other things they're exposed to, be more susceptible and exposed to respiratory tract infections, decrease their lung growth, decrease their lung function, and going into adulthood with low lung function means you're going to have lung disease and increased healthcare needs and costs. And so attacking those are important. And also kind of addressing the barriers that we as Latinos have in caring for ourselves and our children for asthma. And so some focus groups or studies have addressed what are the barriers or what are the things that Latino parents and caregivers are more concerned about or have barriers to. And some of that includes not only kind of access to medication and to care, but also having concerns about what is asthma and what causes asthma. Like a lot of them don't even know. People haven't had the opportunity or the ability to communicate linguistically in the same language, culturally in the same in relatable information for our Latino patients and our Latino caregivers about why it's important to give medication when you don't see your child sick in a population that really doesn't take any medicine unless you see something happening. The concerns about side effects, having problems with healthcare coverage. I'm really pretty scared when March comes around and we won't have continuum of our pandemic health emergency, public health emergency, because all these patients don't know anymore how to get back into Medicaid. And I went into the website myself, and even though there's a website in Spanish, when you click on some of the resources, they're all in English, so they can't even understand how to apply for Medicaid when it's and how often you have to do it in order to still qualify. And so on top of all those challenges come the challenges of just communicating with our schools, our school-based programs, having school nurses understand their child's illnesses and what we can do about it. And so as a severe asthma physician and care and specialist, there is absolutely a lack of specialty care for these patients. We don't have enough specialists, let alone enough Latino specialists. And we don't have the primary care physicians do a really great job of trying to take care of the children, but really don't have necessarily up-to-date information. And asthma in the last few years has really changed as far as kind of what we have available and how we can treat our patients. We don't have sufficient resources in the state, including community healthcare workers that can be supportive to the needs of the populations we serve and have the trust of those populations. The uninsured have almost zero options, and so they overburden our emergency healthcare system. As far as health literacy goes, Latinos, we know everybody prefers to not have any medications, but Latinos and specifically do very poorly with having a lot of medications. And asthma is one of those, you have like several inhalers, and if you have multiple providers, you even have more inhalers. And depending if Medicaid actually covers your inhaler this month and covers a different inhaler in 6 months, then you have another inhaler. So it's very confusing for these patients that don't even understand why we have to be taking all these medicines. And even with translation services, people try to simplify the message and not really answer the questions our patients have. On top of that, we have cost of medications. I'm very fortunate to be in a facility that is able to provide certain medicines to their patients for a decreased cost or at cost. And so that makes a huge difference, but that's not what most of our patients have available. And again, as I said, the end to the public health emergency can become a really big problem coming along. Physicians or even insurances not covering single maintenance and reliever therapy, which has become now standard of care and is what our guidelines, asthma guidelines. So that means using one inhaler as a controller and a reliever. And there are a couple of options for that, but that's something that most even of our primary care physicians, school nurses don't understand. And even when they do, our patients can't get 2 inhalers for 1 month because they may go through their inhaler for their usual therapy, controller daily therapy, but they may need extra puffs when they get sick. And so insurances don't, even Medicaid don't cover both inhalers. And so that's another major, and I'll touch on these last couple of things. And one is air quality, as Representative Meza may be more aware of. Having smoke cessation programs to decrease secondhand smoking is important, but also we have 3 metropolitan areas here in the state of Texas that are outside of the EPA recommendations as far as ozone, and that includes the Dallas-Fort Worth, Houston, and San Antonio. And so those are areas that we need to kind of decrease, but not only outdoor pollution, indoor pollution. There just came out a study saying about 12 to 13% of pediatric asthma may be associated to gas stoves. And so that is another area that needs to be addressed, including, do we use filters in the homes? Do we cover them with insurance? How about weatherization for some of these households? And lastly, biologics have been a kind of a new treatment option in the last decade, and they've really revolutionized the ability of us to decrease exposure to steroids and side effects from steroids, but our insurances don't always cover it. Sometimes we have denials, and different insurance have partnered with other companies or and only cover certain biologics. They're all relatively different in how we use them, and so having no choice or very little choice or one choice for our severe asthmatics, these are the patients that need really precision medicine, right? Individualized medicine, and preventing then the physicians and the specialists from using some of those medications, which just until they fail, just doesn't help that rapport with especially with our Latino populations. You don't get a lot of tries to try to cure your kid. If you want your kid to be better, or your patient or your family member, you may give me 1 or 2 shots, but you're not going to give me 3 or 4 shots in order to get them better. So trying to have insurance companies give us a little more leeway with biologics is also helpful. And finally, there's legislation coming up on stock albuterol in the state. We have stock albuterol, and thankfully that's one of the things we've been better than some other states. So usually we're at the last or the bottom when it comes to healthcare and doing things that other states have already done. But stock albuterol, we're up there. We're this one of 17 states that has stock albuterol legislation. That's the ability to use albuterol in schools without necessarily assigned a form from the physician or a prescription. So unassigned albuterol, and although it is law and bills have been passed, there's still some limitations. And so I work with some of my colleagues who are trying to get that through the legislative agenda this month. I believe that the chair of the Public Health Committee will be helping that group of people, and I'm very thankful for that. But these are some of the barriers that we encounter, especially with our severe asthmatics.
To unmute. Well, thank you, Dr. Martinez and Dr. Johansson. And I think that just to reiterate the support that we have from our doctors here, we're very interested in adding value to your policies that already have been started about albuterol, about focusing on schools, focusing on children, to think about other things that they mentioned. So your thoughts, and let me start with, I believe I have Representative Campos here first, right?
My name is Samantha. I'm with Representative Campos. I'm her legislative director.
Oh yeah, Samantha Crane, legislative director.
Yes, ma'am.
Yes. Do you want to give us your comment? And then we have Representative Terry Mesa.
I'm sorry. I thought that the panel started at 1:30, so I apologize. So I came in late. But okay. If I can go maybe last or follow up.
Oh, okay. We'll switch.
Yeah.
Representative Terry Mesa, member of the Environmental Regulation Committee. And, you know, I'm sure you are very focused on these issues, but I know that you also are a lawyer and have a very keen sense of how to improve policies. And given your experience in Texas, you know, how is it that we can help you understand how to better meet the needs of our communities with asthma?
Hopefully you're not giving me more credit than I deserve. But by the way, Mesa with a single Z, there is such a thing as Mesa with a double Z, but that's more Mediterranean type spelling. Okay. I'm the more simple Mexican style, M-E-Z-A.
M-E-Z-A.
Yes, and I go by Terry because my first name's Teresa. So as y'all will understand, Teresa Mesa is a little sing-songy. Un verso sin esfuerzo. So that's why I go by Terry. I grew up in Dallas area. In a home with a mom who did not believe in giving out pills as medicine for stuff. She was a big believer, however, in Vicks Vapor Rub. So that's what we got, lots of Vicks Vapor Rub. As a mother myself of a son who was diagnosed with exercise-induced asthma. Who knew? I didn't know there was such a thing as exercise-induced asthma. It was diagnosed by a woman who became his pediatrician. She was in the same Taekwondo school with him, and she diagnosed him as having that problem whenever they had their belt tests and tournaments, because that was when it was most prolonged activity. Otherwise, it didn't show up. So she gave him his first inhaler, became his pediatrician, advised him when he was turning 18 that he had to find another doctor. As a pediatrician, she could not continue being his doctor, but thankful to her for helping him get through those years in Taekwondo, because he went on to get his black belt, that she helped him with that issue of exercise-induced asthma that I didn't even know was a thing. I thought asthma was something else. I didn't know about exercise-induced asthma. I'm also care about asthma because I'm part of the Dallas County delegation, and it's been previously mentioned Dallas County is one of the bad areas for our air quality. It's not only the large amount of traffic we have, it's also the industry we have, and it's the industry that we don't have. There's industry south of Dallas, some concrete plants and so on. And so we actually have an organization in the Dallas-Fort Worth area called Downwinders at Risk. Have you ever heard of that? Downwinders at Risk, because even though the plants are not right next to us, the way that the wind goes, it doesn't stay in one particular county or city, it moves. And so we have bad pollution from those plants. So I'm hoping that as I serve on the Environmental Reg Committee this coming session, that I'll be able to help some with that, and also some about environmental justice, as this group would be particularly interested in, I think, because too often the bad industries, the polluting industries, It's not always air. Sometimes there was a battery plant in West Dallas that polluted the ground. So, and then the people who live in those neighborhoods have a higher incidence of a variety of illnesses, including asthma, as a result of industry that's put in their neighborhood that wouldn't be put somewhere else. But because it's a low income, a minority neighborhood, a Mexican neighborhood, then they're more likely to locate those kind of industries there. So I hope to do something about environmental justice while I'm part of the Environmental Regulation Committee. In addition, we're still pushing again this session for the expansion of Medicaid in Texas. It seems like a no-brainer to me. We're the #1 state, but not for a good reason, for having the most uninsured, not only in percentage, but also in raw numbers in both categories, raw numbers or percentage. Texas is the #1 state for having the most uninsured. And of course, with all the Hispanics that we have in Texas, that means a lot of those numbers there for the uninsured include our Hispanic population. Coming from Dallas County, we have a county hospital that's a great hospital. Parkland, it's a teaching hospital together with UT Southwestern, help provide doctors for our community, to the point made earlier. Parkland has a lot of unreimbursed care that if we had Medicaid expansion, that care could be reimbursed. So that would be helpful not only to Parkland Hospital and to patients who would have insurance, but it would also be helpful to those property tax owners that right now are having to subsidize all that unreimbursed care. So people that are anxious to have some property tax relief, if we had expansion of Medicaid, then that would help Parkland and also John Peter Smith and other county hospitals to get reimbursed for unreimbursed care. I also think that our rural legislators should care about Medicaid expansion, because we're having a great loss of rural and small town hospitals in Texas, that a lot of our rural and small town hospitals have been closing. And so while Medicaid expansion may not pay all their bills, it might make the difference between being open and not being open. And once a hospital closes in a small town or rural area, that means that those residents have to travel much farther to get health care. So that's also an issue or a problem. I'm all for increasing the number of residencies that we have in Texas. I think that's part of our problem, not the whole answer, but could be part of the answer to the question about having more doctors in Texas, is that we have doctors, but then we don't have the residencies for them. And when we don't have the residence positions for them, they end up having to take residence positions in other states. And as it goes, once they go off and do their residency in another hospital in another state, it's unlikely that they'll come back to Texas. They tend to stay wherever it is that they did their residency. So we lose a great opportunity for doctors that we've actually invested money into and developing them to being doctors. But then when it comes to residencies, we don't give them that opportunity to do that in Texas. So I'm for increasing residencies. I met with our new president. I'm very proud to say we have the first female president for the University of Texas at Arlington. And I had a chance to meet with her before the session. UT Arlington does not have a medical school, but it does have a school of nursing. And one of the things that we talked about was micro certifications, to be able to put together 3 or 4 classes that a student can take. And when they complete those 3 or 4 classes within the School of Nursing, that they can have a micro certification in something. And that would give them an opportunity to be employed doing that in the medical field, continue their interest, having them involved. It could be kind of a earn while you learn part, to keep them involved in the School of Nursing, so that they don't have to wait until they complete 4 years to be able to have a career and be able to do something in nursing. And so we are looking at that micro certification. So I hope that that's helpful. Trying to think if there was some other kind of legislation that we were doing that was healthcare related, but right now I can't think of anything. So maybe Liz Campos is legislative director. Maybe Samantha can help us out on that. But because they're I'll hand it off to Samantha now then.
Okay, Samantha.
Yeah, thank you. I'm sorry. I appreciate that, Rep. Mesa. Yeah, so just to follow up, so I mean, asthma awareness, of course, is incredibly important. There's a lot of challenges, obviously, that were already stated, but I know that just on a more personal level, with Rep. Campos, that she does suffer from asthma herself. And so there's a lot of challenges that come along with that, just from knowing her myself personally over the years. You know, I know that that can be a challenge overall. In our work in San Antonio, specifically for the district, we have SA Breathe, which is an organization that helps with, you know, awareness in youth for asthma. And so they do a lot of outreach with our office, especially during the interim, when it comes to like back to school events, any sort of like health and wellness or activities that we'll do. We'll always try to include them within those awareness events, just to make sure that we get, you know, that type of publicity for them, you know, to make sure that families are aware of the signs of, you know, possible respiratory complications. And so just to kind of follow up, you know, specifically with what Representative Mesa was saying about the Public Health Committee, specifically with bills. Right now, Chairwoman Cligg, there's a medical designation for treatment of respiratory distress on public and private school campuses. That's going to hopefully gain traction as well, especially with her being the chairwoman, of course, of Public Health Committee. And then Representative Julie Johnson's office as well. They also have a medication designated for treatment of respiratory distress as well on both of those types of campuses. So it is something that we're looking forward to seeing within the Public Health Committee. It is something that Representative Campos does support with regards to making sure that access to the type of life-saving medication can be helpful, you know, to make sure that there is access for it in the schools. But with regards to making sure, you know, that within the Latino community that we rise to meet those challenges so that we, you know, make it better in the future for youth and just for people in general that are suffering from any sort of respiratory illnesses. You know, we just make sure that awareness is always going to be key. A lot of times when I was working in the district, most of what people are experiencing is just not being aware of the resources that are available, even if it is at low cost. You know, as Rep. Mesa did confirm as well, that there is an issue, of course, with Medicaid expansion. It was not something that was an issue on the House. Unfortunately, that was something that was on the Senate side. And so now that federal pushback you know, came in the denial for Medicaid, you know, we have to come back to the drawing board, and hopefully the Senate will be in agreement this time that we really desperately need Medicaid expansion.
Okay, you know, you both mentioned the importance of Medicaid expansion. We know that Texas has so many Latinos, and we are a National Hispanic Medical Association. Is there anything you think would add value from doctors within Texas? You heard from two of our doctors there. You know, I know the Texas Medical Association is very powerful because, you know, they've been organized for years, but you know, we just want to add value from the Latino perspective. Is there anything you think we could do to help, if there's any representatives that we need to follow up with, or, you know, in terms of Medicaid expansion? And Representative Mesa, you gave a great list of who would be supported. It's not just the Medicaid patients, it's everybody in the community, the business community, the, you know, like you mentioned, you know, how can we help? Just, you know, because that would really, I think that was one thing you both mentioned right now that I, you know, is a very, you know, it has to happen sooner or later. But how can we add more?
Contacting your state rep and letting them know that you support it. In general, the Democratic state reps, I can't think of any Democratic state rep that's not supporting it. And there are some Republicans, but I think we mostly need to convince our rural state reps that it would be a good thing for them, that they have a crisis in healthcare in the rural areas. And so it would be helpful for them to have Medicaid expansion there. So we just need to convince them of that. that it wouldn't be being anti-Republican to vote for Medicaid expansion. These are our own dollars that we send off to the federal government. And instead of them coming back to Texas, they go to other states. We just want, let's get our own money back. We're talking about billions of dollars to help make healthcare better for Texans throughout Texas.
Yes, and to continue on with Rep. Messa's point, also too, I think that it would be really useful to understand on the rural side of how much that Medicaid expansion will help, not just necessarily the overall health, but the overall dollar amount of indigent care that Texas experiences, and the money that is used, or rather that is having to be written off by businesses because of that lack of reimbursement. Because I mean, if you don't have any sort of coverage or Medicaid, and especially now with the change in law that medical bills are no longer put onto your credit history, there's not as much necessarily incentive, not to say that there was a lot of incentive before, but if you can't pay it, then are you rather going to pay your medical bills, or are you going to put food on the family for your table, or are you going to make sure, or food on the table for your family rather, I'm sorry. And then, but also just other items as well, right? Everything is a lot more expensive now with inflation and other items as well that are just kind of a bottleneck of things that happen from the pandemic. So if we keep finding solutions, or not rather solutions, but rather band-aids for the problems that we're experiencing versus attacking the root of the problem, then we're not addressing anything at all. We're really just, again, just putting a band-aid on it. And so the amount of money from indigent care and from children not receiving coverage, it's really only children that are ones that end up being hurt overall. It's really the children who suffer, and that's across the board in anything of any sort of cutbacks that we use, and that's Latinos, who suffer from that, especially because we are the growing population in the state of Texas, and so we just continue to have that, unfortunately, like that vicious cycle of poverty among family members, and just continuing on that circle of not necessarily going to the doctor because you're not dying right at that moment, right? And so instead of being able to be proactive and having a preventative care, everything is reactive.
Right.
So I guess just to kind of like follow up and to circle back with what your question was, is that it would be a better idea or if it would be a good idea maybe with those rural communities to talk to them about the cost difference of what it would be to expand Medicaid, and then versus not expanding it, and what that dollar amount is going to be for indigent care, and just in general the continuation of loss of dollar for businesses.
Okay. And Samantha, it would probably be really helpful that when there are bills that are coming before Representative Campos and the Public Health Committee, that there are people in this Zoom call and other places that if you would love to have them come and testify and give their expert testimony, lend their credibility as doctors in this field in healthcare to the bills that are coming before public health. And so I think it would be great if you have people who have the availability to come to Austin. Your testimony before a committee on a bill can make a world of difference versus just Representative Campos or Representative Messa saying, we want you to pass this bill, to have you come and say, this bill is important, and lending your medical expertise to why you think that they should pass that bill out of committee and get it onto the House floor.
Well, we'd like to do more of that. And I just want to let you know that Dr. Johansson here is actually one of our leaders of the Texas chapter of the Hispanic Medical Association. And Dr. Martinez went through our leadership fellowship program, and we have doctors very interested in raising their voice at a more, at advocacy level policy meetings. And also the other thing I was going to ask you, how you can help us with getting more of our doctors appointed to advisory committees within the Texas policy world. The state has different advisory committees, and we nominate our doctors all the time to do leadership activities where they can change the dialogue. And so whatever we can do to help, and we'll follow up with your offices, but if there's something, Bert, I don't know if you wanted to say something about, you know, your chapter, and it's mainly based out of El Paso and San Antonio. San Antonio, doctors not being too far from Austin.
Well, first off, thank you. You've made, I'm sorry, I'm getting emotional, but finally I'm hearing intelligent people telling me things that I can do to help my patients. And so thank you so much. And the answer, Senora Mesa, absolutamente, fregón. Let me know and I will show up. I've also been working with the Texas Doctors for Social Responsibility. One of our we have two main issues. One is trying to get Medicaid expansion. The second, we just gave a talk 2 weeks ago, and we actually had two of the mothers from Uvalde. We had the ER doctor and the surgeon. So I'm looking also to get some responsible gun laws passed. You might have gathered I'm in my car because I have two patients back in my unit that were shot a few days ago.
Oh dear.
Oh my goodness.
Okay, and it's in like in the same place that 3 years ago we had 21 people killed.
Yeah.
The Cielo Vista Mall, right?
Yes. No,
Yeah.
We've got, you know, and I can tell you one of the issues people talk about guns, and I know there's a great book called Misinterpreting the Second Amendment. But rather than going for people's guns because of the strange relationship they have with them, go for the ammunition.
Mm-hmm.
These kids were shot with something called hydroshocks. It leaves a wound about as big as your pinky, but the exit wound's about that big.
Oh dear.
Mm-hmm.
It's called high linear energy transfer. In other words, the bullet's moving at about 1,700 centimeters per second, and it doesn't exit, which means all of that energy is in the body. I believe that we need, because I don't think having a gun ban in Texas is going to work. I'm sorry, people are just too attached to their guns. And yes, I'm a trap and skeet shooter, you know, so I'm not. However, I think if we can control the ammunition, we may be, I won't have to have the conversations I sometimes have.
Yeah.
If Texans could see what the doctors had to see with the Uvalde children, how their bodies were just totally destroyed. It's not like we think of a gunshot like when we watch a crime show on TV that's like a little hole or something. And I haven't seen it, don't want to see it, but I'm thinking if we saw what doctors saw about what damage those that ammunition did to those poor little children's bodies, that they didn't just get shot and have a little hole in them. There was a lot of damage to their body, to the point that their parents had trouble recognizing them. Most known by the little girl who was identified by her shoes.
She was decapitated.
Oh my goodness.
Oh my God.
That's terrible. Well, let
me.
me
point though, Ms. Rios, Dr. Rios, excuse me, Dr. Rios, you worked hard for that title, so I want to use it. The about appointments. I don't get appointments, the right to make appointments to those patients, but the governor's office has a person that's in charge of working on appointments to boards and commissions, that the governor makes those appointments to those state boards, commissions, committees, and so on. And so she accepts, I say she, it's usually a female. I'm not sure this session, what it was in the past, that she, that person accepts resumes and for appointments to boards and commissions. So they have that title, like something like the they're the person in charge.
Appointment secretary or something. Yeah, we'll follow up.
I'd be happy to send you guys that information, just as somebody staffer. I'd be happy to go ahead and send that information to you guys.
Thank you.
Yeah,
thank you. Well, let me just say that on the same type of creative policy making, if you will, that Bert just mentioned, Dr. Martinez mentioned the biologics and the newer therapies that are always the ones that trickle down in medicine. It takes years for the primary care doctors, to understand what kinds of armamentarium they have, the treatment therapies that are new. And is there any way to focus in on newer treatments within the asthma world of policymaking? It's not just about children or adults. It's as a whole, our community needs to have access to better care. And just like Bert said, maybe don't go after the guns, go to the ammunition. Well, maybe, to decrease asthma, we know that air pollution isn't going to change overnight. although the Biden administration put in more money for climate justice, and that money is going to go to underserved communities that are the most vulnerable, like your Dallas and San Antonio and Houston that you mentioned have the highest ozone rates. But we can't just wait on that. I mean, that'll be a short term, but longer term is to change the policies to actually catch up to the science where we have better treatment now. And is there any thought on or any way we can help you with getting better policies for treatments? It might be an issue of the insurance companies' formularies, might be an issue of the costs of the drugs. I'm not sure, Dr. Martinez, do you have any thoughts on what you think would be some strategy to help with getting better the newer treatments for severe asthma that can be supported with policy?
I mean, I think with pediatrics, we have usually some coverage. It becomes really difficult to have adult care. So, I mean, kids get to 18 and then they have nowhere to go. And to have, you know, again, we go back to Medicaid expansion. And so maybe that is another way to address some of this, is how to then decrease the costs that we have. Again, property taxes and everything else we use to pay for emergency care and increase acute asthma care, which is really high in our state. I mean, to pay for acute asthma care in the state is a high burden that we do. And so putting those dollars into kind of more chronic long-term care of asthma, including these biologics that have really been really revolutionary. I mean, a lot of these medications people can use once a month or once every 2 weeks. And yes, compliance with that can be much higher, especially initially. I think over time, you know, everybody gets sick of doing anything, but I think initially it does help, and then continuing to push, you know, education. So, you know, as I've been hearing you all, you know, I still think empowering Latinos with information is one of the things that costs probably the least and impacts the most. I mean, we have a lot of Latinos that vote, but they don't know any of this information. They don't know, you know, what that asthma or healthcare or, you know, prevention is that important. They don't understand air pollution, but they understand that it's a problem, and they're willing to vote for policies that will attack air pollution, but they just don't know and they don't understand it. So first we need to empower our own population. And then we have, you know, Hispanic serving institutions, you know, the historically Black colleges and universities are really well structured and empowering, you know, their students to, you know, do better or to become physicians. And our Hispanic serving institutions tend to be more like community colleges. And so we need to also empower those students with the ability of looking for higher education. And that's, you know, nursing and becoming physicians and becoming Latino healthcare workers, not just medical assistants. I mean, I can see somebody coming into my hospital, and depending on what their background is, I know what their job is, because they are kind of pigeonholed into some certain jobs, and we need to be able to allow them and provide them education to get out of that.
Okay.
And I do think that like, and to follow up with that, Dr. Martinez, I just seeing with the number of grants that might be available when it comes to like CTE for STEM, or like specific for training, like education training in schools, where there's organizations and agencies, excuse me, for Texas, where, you know, there's really a focus right now on, because right, for instance, like with plumbing and HVAC and certain manual labor items, right? Those are jobs and occupations that don't require necessarily a lot of schooling, or if it is, it's like, you know, short-term vocational schooling that they can essentially knock out during high school and then graduate and immediately see that return with high paying jobs. And so that's really where a lot of, like, I know specifically in House District 119, one of the things that we're always talking about with the schools is going out there and or at least with the superintendents and with the school boards, talking about, you know, how can we make students certified in certain vocation training where they can get money or start making money for their families immediately out of high school. And so those are the ones that are more manual labor work, right? Not necessarily the long-term approach to being a nurse versus a CNA or being what is the other one? I'm sorry, like a vocational, like vocational nursing versus, you know, actually being a nurse, a full-blown bachelor's of nurse, right? And so there's a lot of other items that go along with it, right? And so how you had said the historically Black colleges, they really do focus on that, where, you know, they have that term of Black excellence, right? And so we really don't have that within the Latino community, to not to say that there's not that push for it, but we don't have the type of culture around it, because it's like, hey, you have to work hard. Sometimes, you know, siblings are the ones that are helping out mom and dad with rent, multiple families living within the same dwelling. And so it's really like almost a cultural shift that we have to make for that, to encourage diversity in healthcare, and making sure that, we're not just being stuck with medical coding or being, you know, a CNA, anything like that.
Well, you know, we talk about the teacher shortage in education, and found that one of the ways that we can address the teacher shortage is right there within our schools. There are teachers' aides that have shown that they care, that they are devoted to public school education, that they work with students, they have a passion for it, to invest in them and encourage them to move up from being a teacher's aide to being a teacher. And I think we could do the same thing in the medical profession. Maybe I'm being idealistic here, but there are people that have already shown that they have an interest and they care about being involved in the healthcare profession. If we invest in those people who are RNs or other roles in the hospitals, that they are interested in the medical profession, and invest in them and encourage them to achieve a higher level or higher status in the medical profession as doctors. I think they already show that they care about healthcare, maybe investing in them to be more. I also want to mention about my love-hate relationship with insurance. We're talking about how we want to have Medicaid expansion, we want to have health coverage with insurance and everything. And yes, we want all that, but that's the love part. The hate part of my love-hate relationship with insurance is how much I dislike that insurance dictates what you doctors can do sometimes with patients, that you know what the best thing is, but then you have to turn around and say, okay, and what will their insurance pay for it? What can I get covered? And so how much insurance plays, I think, too big a role in what kind of health care our doctors get to provide. So I'm saying that as a non-doctor, I just have noticed that and don't like that relationship between insurance and I don't like the idea of insurance companies deciding about our health care.
I agree with you,
right,
Representative.
Yes, I think we all agree. It's important to be able to be as creative as possible, and also to look at patients as a case-by-case approach, not just everybody blanket gets the same medication or gets the same, you know, recipe. But anyway, let me thank you both. We're going to switch to hear from Nimisha Bhakta, who's the Director of Health Promotion and Chronic Disease Prevention with the Texas Department of State Health Services. I just want to tell you thank you again for all you're doing. And let me just say that the National Hispanic Medical Association's Texas chapter is represented by Dr. Bert Johansson, who's here. And Dr. Martinez is a pulmonary specialist, you know, who also has lots of expertise and with the connections that she has within the Dallas area. And like you mentioned, the stakeholders that you work with, or the contractors that you work with, that she's also plugged into. We have many other doctors who let me just say, are very interested in getting more engaged in advocacy and in program implementation, like education. And, you know, to the extent that you have ad hoc committees or any type of focus groups, you know, we'd be happy to provide you with nominations. We nominate doctors every other week to doctors who are our members so that we can elevate their voice. Who they have their you know, their ear to the ground and know what are the challenges, but more importantly, they know what works because they're taking care of sick people all the time, but they know what works to keep people from being that sick. And so we need to work together with public health, with the public health department, and with you, Namisha. And we also need to work with our legislators and count on us to be a continued resource. And we need to build these relationships through our chapters. And unfortunately, with the COVID-19 and everything going Zoom and viral, I mean, you know, virtual,
yeah,
we need to come to Austin, and we need to be more of a voice there. We were there a couple of times. We've had some summits. We've brought doctors from around the state to Austin, and we'd be happy to do that again in the future. And I will continue the dialogue with your staff and you know, with the legislative. We've also worked with the Mexican American Caucus, you know, the state legislature, and you know, it's important to know that we are very interested in building the leadership especially among the younger doctors that really do want to make changes like fast. And we do work with social media, so whatever we can do to amplify your messages, we'd be happy to do that. So and we'll send you follow-up information, but we have to wrap up. We're already over time, and want to thank you all very much. Jason, is there anything else? Jason? I want to thank the staff.
Yes, that's all, Dr. Rios.
Huh?
That's all, Dr. Rios.
That's all? Okay. Okay, well, I'll see you. Have a great day in Texas. And you know, if you're in DC, look us up.
So much. I appreciate everyone.
Okay.